Hello, and thanks for coming to another episode of Doc Talk Beverly Hills. My name is Ariel, and we're here with board-certified plastic surgeon Dr. Katzen. Hello.
Hello. Thanks for having me. Good, thanks. How are you?
Good. Today we're going to be talking all about breast reductions.
Good.
What is a breast reduction, and who is qualified for a breast reduction?
Sure. Breast reductions are, like the name implies, a reduction of the size of the breast. And today we're going to be talking about female breast reductions. So breast reductions are for women that are looking for smaller size breasts.
Okay, so anyone with breasts qualify for this?
Yes, if you feel your breasts are too big for your body. And that can be due to maybe the breasts got very large during puberty. Maybe you were overweight and then lost weight, but the breasts still remain quite large. Or maybe the breasts are out of proportion with the rest of your body, and you're just looking to reduce the size of your breast.
And what's the difference between the breast reduction and the breast lift?
Good question. So a breast lift is just lifting the breast. So when we're doing a breast lift, it's very important for us to consult with the patient to see exactly what they want. So when I see patients, one of the first questions I ask them is, what are you looking for? And typically I'll get answers like, I want the breasts back to where they were. So to me, that means a breast lift. And then I'll ask them subsequently, do you like the size of the breast? And the answers will be, yeah, I like the size of the breast. So that means we just do a breast lift. Or possibly, no, I want my breast smaller. So to me, that means we're going to be doing a breast reduction. And whenever we do a breast reduction, we're always doing a breast lift. But not all breast lifts are breast reductions.
Okay, that makes sense.
Okay. So sometimes when I do just a lift without a reduction, the amount of tissue that I remove sometimes can be about a teaspoon or even just a tablespoon of tissue. Not much, because what we're doing in a breast lift is we're removing just skin. Mm-hmm. With a breast reduction, we're removing skin and a lot of breast tissue. And the proportions are like 99% breast tissue and then 1% skin. So we're not removing much skin. It's the majority of breast tissue we're reducing or removing.
And have you noticed like a certain cup size where it seems to be too big for women? Like, does it tend to hurt their back? Is that why they come in?
Yeah, there are multiple reasons why people come in for breast reductions, but typically it's neck pain, it's upper thoracic, upper back pain, it's bra strap groove pain. Those are the pains that are associated with the breast. 2, there can be rashes that develop underneath the breast. Basically, the breasts hang over the upper abdominal wall, and they trap moisture, which then causes infections either of fungus, fungal infection, or bacterial infection.
Okay. And so when we come in for a consult for a breast reduction, what's that like?
So you'll come in, you'll call the office, you'll schedule a consultation, I'll examine you, and we'll basically examine your breast in terms of the proportion to your body. So some larger breasts fit larger patients, some smaller breasts fit smaller patients. So not everyone needs a breast reduction. But if you qualify, and that's based on height and weight, body surface area, etc., there's this funny thing called a Schnur scale, which basically evaluates your height and weight and determines how much breast tissue needs to be removed to qualify for insurance for a breast reduction. So that's if we go the insurance route. Now, if you just desire elective cosmetic breast reduction, that's different. Then we don't have to worry about qualifications based on height and weight. So to determine the size of the breast, basically that's patient dependent. So if we are... ask him.
All right. How do we determine the size of the... How do we determine how much you're going to reduce the breast by?
So that's completely patient dependent. Now, I reduce the size of the breast as to what the patient wants, not necessarily what the insurance wants. Insurance is nice, and if we have coverage for that, that's nice. But at the end of the day, you're a patient. You have to live with the size of the breast. So I consult with my patients, what size do you want to be? Some patients typically want to be like a B or a C or sometimes even a D, but we don't go far beyond the D range because, a D is a pretty large size. If we're doing a breast reduction to a D, that's pretty large.
Mm-hmm. Okay, so we're coming in for our consultation, we're determining the size. I know that when we're doing breast augmentation, making the breast larger, we have a rice test that we could do at home to determine how big we want the breast. Now, what is the alternative for a breast reduction?
Yeah, it's kind of hard because there's no real test you can do at home to visualize or see what size your personal breasts are going to be. So what I would advise patients is, look, go online. There are thousands, millions and millions of pictures you can look at on body shapes like yours. So find a body shape like yours with a breast shape that you would like. And that gets, in my mind, the visual you're looking for. So some patients that are coming in for breast reductions typically say, I just want my breasts smaller. Well, smaller can be a variety of things. It can be a D or a C or a B or an A. Those are all smaller in a wide variety of shapes and sizes. So it's much better to come into the office, in my opinion, with a collection of pictures. Don't go crazy. Maybe bring in about 5 or 10 pictures. We don't need 100 pictures, okay, of breasts you like, of bodies that are similar to yours. Now look, if you're 200 or 250 pounds, please don't bring in pictures of patients that are 100, 120 pounds of breast you like, because those body types aren't going to match. Bring in pictures with bodies similar to you.
Okay, great. And let's talk about surgery now. Is this done under general anesthesia?
Yeah, the surgery is done under general anesthesia, completely asleep. I use board-certified MD doctor anesthesiologist. I don't think it makes sense to do these procedures under local. Typically it's done in a surgery center, like you go home the same day. Sometimes it's done in the hospital, but nonetheless, even when it's done in the hospital, typically it's an outpatient surgery, like you go home the same day. Now, I usually don't use drains, but a lot of plastic surgeons do use drains. It just sort of depends on your plastic surgeon's comfort level. And the procedure typically takes about 3 to 4 hours, depending on how large the breasts are and what really needs to be done.
Okay, and what are the possible complications of a breast reduction?
Like any other surgery, there are possible complications of problems under anesthesia, which are really rare nowadays. I use board certified, again, MD doctor anesthesiologist. General anesthesia, we do a very thorough workup preoperatively, so problems under anesthesia are pretty rare. There's always a risk of infection. It is surgery. You're going to get antibiotics before, during, and after the surgery, so risks of infection, very, very low. And then there's always a risk of the incision opening, either partially. I've never seen the incision completely open, but that's always a possibility. Pretty rare. Then there's also a possibility of you rejecting the stitches, the sutures that I use to close the incision. There's always a risk too of part of the areola, the pigmented area around the nipple, dying. Okay, and that's always a possible complications because, again, we're moving that nipple areola complex and relying on your blood supply to keep that thing alive.
Okay, and what do you do to prevent these things from happening, especially the dying nipple part, because I know that's a big concern for people.
Very big concern. So, most important thing is you must quit smoking. And you must quit smoking 3 to 4, not weeks, but months before the surgery. Nicotine definitely affects the survival of the nipple areola complex. The other thing is if the nipple hangs very, very low on the breast and I have to move it a significant amount of a distance, then there's a higher chance of necrosis or death. So the lower the nipple is, which you can't really change, the higher that chance. So if the nipple goes beyond a certain length, we may be thinking about doing a free nipple graft where we take the nipple off completely and put it back like a postage stamp to maximize survivability. Now, if we've done the surgery and we're worried about the blood supply to the area, in the operating room, sometimes we may release the sutures, let it get some blood supply, and then redo it again and close it up again. Sometimes we may put some tacking sutures to relieve the pressure that's going into the nipple areola complex. Now, if there's some ischemia or some questionability of the nipple areola complex after the surgery, we may apply things like nitropaste to increase the blood flow, to increase the blood flow to the nipple areola complex by reducing the venous load. Anyway, and then another thing we can do is we can get you in a hyperbaric chamber to force oxygen into the tissue. So those are some of the maneuvers we can do after the surgery.
So there are complications like all surgeries, but there are also a lot of preventative things that we can do
Absolutely.
to avoid that.
Absolutely. So, quit smoking, eat right, make sure your garment is positioned correctly. If anything is tight or doesn't feel right, make sure you call your plastic surgeon right after the procedure.
And what are the chances of insurance covering this procedure?
Depends on you, your anatomy. Okay, depends on your conditions. Do you have fungal infections? Do you have bacterial infections? Are they very hard to treat? Have you been trying to treat them for the past 5 years and they haven't gotten better? Do you have chronic neck pain, chronic back pain, chronic shoulder groove pain, having difficulty finding bras that fit? All of the above. As well as the physicality, the dimensions of the breast. Are you a D? Or are you the size K and the breasts are below the belt line? Different patients, okay? Number 2, is the insurance type you have. Some insurance companies categorically deny all breast reductions. Some insurance companies are more lenient on breast reduction. So it really depends on your insurance company too. I can have two patients with the exact same breast, and one will get accepted and one will get denied, and that's just based on the quality of their insurance. So the better your insurance, the more likely it is that these insurance companies will cover the breast reduction. And then 3, it really depends on your plastic surgeon's submission of the letter. Does your plastic surgeon have a detailed letter, 3 or 4 or 5 pages with pictures included? Or is your plastic surgeon saying, yeah, she might do better with a breast reduction? The insurance company is much more likely to reject that claim.
And is the letter something that you've helped patients out with in the past?
Oh, yeah. So when patients come to the office, if I think it's acceptable, I will write a letter to the insurance company explaining, based on this patient's symptoms, anatomy, things she's complaining of, that this patient would benefit from a breast reduction.
Do you think it's necessary for some people to get the breast reduction?
Oh, yeah. So there are many patients who the breast reduction would significantly help with neck pain, back pain, shoulder groove pain, those rashes, and the benefits of the surgery far outweigh the complications.
All right, and let's talk a little bit about recovery time.
Yeah, recovery is pretty easy compared to some of the other plastic surgery procedures. So I would give yourself maybe about a week to return to a sitting job. If you have a very physically active job, maybe we're looking at about 2 weeks, maybe about 3 weeks, depending on the physicality of your job.
That's pretty quick turnaround time.
Yeah, it's pretty quick surgery. And of all the plastic surgery procedures we do, head to toe, whether it's rhinoplasty, liposuction, tummy tucks, buttock implantations, BBLs, things like that, of all the plastic surgery procedures, our happiest patients by far are the breast reduction patients. So we've known that as a collective. That means plastic surgery societies all over the world have experienced the same thing. Breast reduction patients are usually the happiest patients of all our plastic surgery patients.
Wow.
Yeah.
Well, that's good. That's good for everyone.
Yeah, so it's a very worthwhile surgery, maybe covered by insurance depending on you and the insurance. So I think it's a very worthwhile surgery to perform.
And let's just last talk about the combinations that we could do this breast reduction with.
Sure, yeah. Now, combining the breast reduction with other surgeries really depends on your health. So if you're not healthy, we're not going to combine other surgeries. But other procedures can be combined. So we can do tummy tucks, very common combination. Tummy tucks and breast reductions. Maybe a mommy makeover. We can combine liposuction with the procedure. We can combine arm lifts, arm reductions, facelifts, rhinoplasties, liposuction, buttock implants, liposuction of the thighs, thigh reductions. So all those combinations can be applied. Really, there's no procedure that I can think of that can't be done with that procedure. Again, it depends on your health.
Okay, great. And last thing actually is that people always ask for BMI requirements. How would you answer that one?
Sure. Now, BMI is very important for insurance cases for breast reduction. So BMI is a number. It's an important number, but it's not the end all that tells your entire medical history. Mm-hmm. So I have some patients with a higher BMI, and they are very healthy, and they're much healthier than they used to be because their BMI was sometimes double that number, and they do qualify for a breast reduction. Now, what happens in the insurance authorization for breast reduction? They base the authorization on your height and your weight. So if your weight is elevated, there is a higher chance they're going to reject the breast reduction based on your BMI. So if you're looking for insurance qualifications for the breast reduction, you have to get your BMI as low as you can.
Okay.
Less than 30.
Gotcha. All right. Well, I think that's all the questions we have for today's podcast. Next week, we're going to be talking about Vaser high-def liposuction.
All right. Good. Well, thank you for having me.
Thank you so much. And if you guys have any questions, please contact Dr. Katzen at 310-859-7770 or message us at Dr. Katzen MD on Instagram. All right. Have a great day.
Great. Thanks. Bye.
Thank you.